Welcome to Getting Your Dream Smile with Cosmetic Dentistry. This is where we discuss and help patients get what they want in a smile while being totally informed. Whether it is porcelain veneers, bonding, whitening, or Invisalign, you'll find out what is best for your situation. Everything you should know, where and who to see, and all the costs involved. Stay tuned.
Welcome back to Getting Your Dream Smile with Cosmetic Dentistry. My name is Sabrina, your co-host today. I work with Dr. Eshom to inform the public about the best way to achieve your best smile with cosmetic dentistry. Our podcast discusses the benefits and what you need to know about cosmetic dentistry. Let me introduce to you my co-host, Megan.
Hi, I'm Megan. Today we'll be talking with Dr. David Eshom, who's been practicing cosmetic dentistry for 25 years as a credentialed cosmetic dentist from the American Academy of Cosmetic Dentistry and specializing in minimally invasive cosmetic dentistry. Dr. Eshom loves sharing his recommendations when it comes to getting a great smile. Let me introduce you all to Dr. David Eshom.
Hello, Megan, and hello, Sabrina. And I'm so honored and to have a very good friend of mine who thinks along the same lines as I do in dentistry, but he's all the way in Miami, Florida. And we have the very famous Dr. David Carroll, who's going to speak to us about his practice and his practice of minimally invasive cosmetic dentistry. So I'm going to let Dr. Carroll tell the audience a little bit about himself. And then from there, I think we're going to just have Dr. Carroll go over some cases, and we'll ask him some questions as we go.
So well, thank you, David. It's great to be here and great to join you on this podcast. I know we've chatted before a little bit back and forth, but we've never actually gotten to talk live together on different sides of the country. But I know that a lot of our training is somewhat similar. I noticed I followed you on Instagram and followed some of your work and everything. So I know you're trained in orthodontics, you're trained in Bioclear, which is similar to my training, and you're trained in a lot of minimally invasive cosmetic dentistry, which is what we're going to talk about today. So I think what might be helpful for everyone is if we just kind of look at a couple cases, and Megan and Sabrina might describe what they see when they see these cases and what it means to them. So I guess, Sabrina, you said you're in training to be a dentist. Is that right?
I am. I'm currently a pre-dental student at UCSD.
Okay, so that means Sabrina has some dental background and Megan has more of a, let's say, a view from the normal public, let's say.
Yes, exactly. I work as an admin assistant in Dr. Eshom's office, but don't have a dental background. So.
Okay, that's perfect, because that's great, because we get to see, different views from different opinions. Because when David and I look at work, it's sometimes we're looking at it just through dental eyes, and it's not the same as what the public will often see and what patients want to see. So I'm going to try to screen share something right now and see if this works. All right. How's everyone doing? Okay.
Yep.
We're doing good, and it looks great, Dr. Carroll. And I'm so excited to see what you have to show us today.
All right. Awesome. So, so my background is I am trained as a prosthodontist, which means I'm a specialist in crown and bridge and implant dentistry. It's a specialty after dental school. I did my training all at UAB in Birmingham, Alabama. And then I returned back to Miami, Florida, where I grew up, and I joined my dad in practice. So I'm a second generation restorative dentist. And so my dad and I have practiced together for 27 years, and he just recently basically retired. So, so my background is kind of relatively, I guess, broad in the restorative dentistry world, but only recently, I would say in the last maybe 5 years, have I really kind of geared more towards minimally invasive and less cutting away of healthy tooth structure. So let me show you a couple cases that are minimally invasive.
Wonderful. Sounds great.
So this is a young girl, and these are the kind of patients that David has walking into his practice quite often. And you can see she actually has a nice smile, but she's worn the incisal edges of her teeth. And pretty dramatically worn them down. Now, she happens to be in her early 20s. So it's kind of common in the United States that a lot of dentists will approach this as what we call a porcelain veneer case. And when we say the word veneer, what we're talking about is basically laminating the outside of the tooth with a layer of porcelain that covers the whole outside of the tooth. And that's a super common way to approach that. There is another way that you can approach a wear case like this, and that is to just add the length back to the teeth. And that can be done really minimally invasive with composite resins. And instead of covering the entire tooth, we're just covering, say, the bottom half of the tooth, but it's hard to see where the junction is. And that can be blended in so that it looks relatively seamless. So,
yeah. So excuse me, Dr. Carroll, for a second, just to describe to our listening audience, you know, the smile was very nice with beautiful lips, and the teeth were mostly arranged on this young lady, but the edges of her 4 front teeth, or maybe even the 6 front teeth, you know, had a lot of wear. They were uneven, and there was chips, and those teeth, you know, looked like they were maybe 40 years old or 45 years old, and this was a 20-some-year-old girl, and so that was kind of disconnecting of her lips and her face versus her teeth. And so Dr. Carroll now is showing the case with her restored, and I'll let Dr. Carroll continue to describe, you know, the restoration.
Yeah, so this is like one of the most ultra conservative methods we can do. And it's what's nice about this materials is when we don't use porcelain and we use something like composite resin, if she were to wear it or chip it again, it's relatively easy for us to repair it or replace it. So that's why I went more with this method. The other thing is that she really wanted to preserve her natural look. She happens to be a model with a pretty large following on social media. So she wasn't looking to have a new look. She just wants to bring back her natural look before the wear. It's also important that we know that we restore these edges of these teeth before they become even more worn down, because a tooth has layers to the tooth. And as you progress into the layers of the tooth, you get into softer layers of the tooth. Once those softer layers are exposed, the teeth will wear even faster. And so we don't want it to accelerate on somebody her age. So here we built in her something that she could actually wear on my material that I put on there instead of wearing her own teeth down. So I would rather have her wear a material that I put in there versus wearing her own teeth away. So that's her, basically her before and after with a background so you can see the work completed. Yeah. So David and I have similar training in a modality called Bioclear, and patients can research what Bioclear is about. But basically, this is another, I guess you would say, another method in our menu of options, which allows us to be very conservative with things like spaces or gaps. So here in this picture, we see a patient who has traveled several hours to get to see me because she would like to restore a space between her teeth, and she does not want her teeth cut down or filed down in any way. So this is just a routine thing that can be done with Bioclear method, where I've added to 2 of her teeth and closed the spaces off and given her a very natural look without having to file or cut down the teeth at all. So with porcelain, that would have been very difficult, if not impossible, to get a natural look without at least some shaping and some filing to the teeth.
Yeah. What do you think, ladies?
With a case like this, how long does Bioclear last?
That's a great question. Whenever I do Bioclear restorations like these, I'm really telling my patients that I'm expecting something like 8 to 10 years before I have to do a revision to the work. If I if the patient's committed to doing porcelain restorations, I might expect those to last a little longer, but not always. It depends on the patient. It depends on their habits. It depends on if they grind their teeth. It depends on if they're what their hygiene level is, if they're prone to recession of the gums, and so all kinds of things. So everybody is so different. So it can be often hard to predict how long things will last. But in general, for Bioclear, I look at basically an 8 to 10 year program without significant changes.
Yeah.
And
Sabrina,
how
how
do
do
you,
you-
questions?
How do you feel about that, David? How do you feel about when you describe Bioclear versus porcelain? What's the longevity or the time frame that you're looking from your restorations?
I say exactly what you say, 7 to 10 years.
Okay.
And I tell them, well, even if something happens to it at that point, it could be a lot of times repaired without having to have the whole thing off.
Mhm.
And much like you said, with porcelain, you have to take some healthy tooth structure away in order to put a porcelain veneer on. But with Bioclear, your tooth structure is still under there, even if it falls off. So you always have something good to work with, and you're not losing tooth structure every time a porcelain veneer falls off. You lose some tooth structure in getting the new one. So that's kind of what I tell them. But that is a beautiful case. And for the listening audience, there was some space between this person's second and third front tooth. And Dr. Carroll just did an amazing job of making the tooth the right proportion and closing the space at the same time. So somebody really wouldn't be able to know anything was done to those teeth. And he did it all by just adding to this person's teeth without any kind of subtraction.
Yeah, so that's one of the beauties of the Bioclear is being able to do additive cases without subtraction. Once in a while, if a tooth is too far forward or if it's too pronounced in the smile, we might want to do a little subtraction before we do Bioclear. But I'll show you in a minute for those of you who can see what we're looking at here, I'll show you a case as it progresses, so it'll make more sense on how Bioclear actually works and why we are able to close spaces without cutting away tooth structure. So basically, for our listening audience, and Megan will probably find this somewhat interesting also, is that when we work with porcelain, we're talking about an indirect method of working. So we have to shave a tooth or shape a tooth, and then we have to take an impression or a mold. That impression could be taken digitally, or it could be taken with conventional materials like putty that you put in somebody's mouth. But porcelain is always worked out outside of the mouth, and that's what we mean by indirect. Because it has to be fabricated outside of the mouth, it has to have a way to go onto a tooth. It has to have a path that it goes on. So we can't just wrap it around a corner or surround a tooth with it or bury a tooth in porcelain. We have to have the tooth the right shape that a dental technician or even in-house that we're able to fabricate this in a way that it goes on a tooth. And that's what restricts us with porcelain. And that's why when we work with composite resin and we are doing Bioclear method, we're able to surround a tooth because we're doing it right directly in the mouth, which brings up another point that is sometimes advantageous for patients who travel a long distance to see us, is that it can most commonly be done in one visit. We don't have to have the patient back. We don't have to cement or bond anything in on a later visit because we're commonly done in one visit. So let's look at one more case. And real quick, so this is a patient who was treated orthodontically and her ortho relapsed. She came from an orthodontist, and actually the orthodontist sent the patient to me because the patient decided that they didn't want to go back into orthodontics again after having not worn a retainer for a few years and the teeth started to spread apart. So these teeth have spaces and some gaps, and she doesn't really like her smile. So here's a little bit just a little bit about how Bioclear works. We isolate the teeth, we clean the teeth very thoroughly, but you can see the teeth are fully intact. We haven't cut the teeth away. And now we're surrounding them with these things we call the aquarium, okay? This is like our molds, okay? And we're into these molds, we're gonna flow a warmed composite resin, and then we're gonna carve it right at the chair side. After we flow it and carve it, we get this result where we can rejuvenate, excuse me, we can rejuvenate these teeth and rejuvenate the smile in that single visit appointment. And so that's her before and after looking straight on. And that's her before and after from the side that she disliked the most, where she was showing those gaps. So in a quick nutshell, that's basically Bioclear in a nutshell and how it works.
Wonderful. That looks amazing. What do you think, ladies?
I think it looks amazing. And like, as you can see, like there's no tooth structure taken away. You're simply adding on and you still get amazing results. And so Dr. Carroll, I had a quick question for you. I was wondering, why do you think it's so important for patients to know about minimally invasive techniques if they're considering a smile makeover?
Well, I think there's a lot of things for patients to consider. You know, one of them is how they feel about their teeth. Are they comfortable with some tooth being shaved away or not? Because I know, I mean, David has patients that come into his practice just like I do, and they are like this patient. They've gone through orthodontic therapy. They've tried to align their teeth, and they're really objecting to the thought of having enamel carved off of their teeth. So it's not that all porcelain cases require a lot of reduction for tooth structure. Sometimes we are able to do porcelain in a minimally invasive way. But in general, so for a patient to know whether they're going to require a lot of tooth shaping or not, a good general rule is if you're seeing spaces between your teeth, if you're seeing dark shadows, if you're seeing what we call black triangles where the gum has receded away and you're seeing these negative spaces in your smile, in general, to do those cases with porcelain, you're probably going to be a fairly aggressive preparation to the teeth to make those happen. If your teeth are perfectly aligned, but they're just a little small, or you don't like the color of your teeth, those might be able to be helped out with porcelain without having a lot of preparation to the teeth. So now, what does preparation to the teeth mean? In some patients, it might mean that we are going to take away 20 or 30% of the tooth. In other patients, preparation might mean we're going to take away 60% of the tooth, maybe more. So it's important for patients to kind of get a feeling of what that means and what are the potential complications of shaving away tooth as opposed to preserving your tooth. We know that the strongest part of the tooth is the enamel. That's the outer layer. As we progress into the inner layers of the tooth not only gets weaker and more susceptible to problems, it also becomes more sensitive and the tooth gets softer, and our bonding methods that we use to attach the tooth become less predictable long-term. So David and I do bonded dentistry of any kind, whether it's porcelain or composite based, we want to see enamel. We want to see that outer layer of healthy tooth structure looking right at us. If we know we have lots of enamel to work with, we know we have a predictable long-term case. As soon as the enamel starts going away and we're looking into the inner layers of the tooth, which patients can recognize because those inner layers are darker, they often look yellow or more of a brown tint. As soon as we see that, we know that our predictability is starting to drop. So that's why it's so important to preserve as much of that enamel as we can.
Great, good question, Sabrina. So, Dr. Carroll, what would you say to a patient if they wanted to have like multiple teeth whiter? How white can they get with Bioclear versus how white can they get with porcelain veneers?
Okay, so if that's a great question, David. So one of my criteria I use for deciding to helping patients to make a decision is if I'm seeing a lot of different colors in different teeth in the front of the mouth, that will sometimes be, or if I have to do a big dramatic color shift, that will generally lead me more towards porcelain than Bioclear composite. That's just sort of my comfort zone. Like I know if I have to lean on a technician who's very talented, I can use that technician to try to mask lots of different colors. So if we're seeing teeth that some teeth are dark from root canal treatment, or teeth are brownish and stains that we can't remove through tooth whitening, then that might trigger me to go more towards an indirect or a porcelain method and work with a technician. If the teeth have basically a nicer color, like what you see with this patient, then I'm more comfortable going with composite and with Bioclear.
I agree, and that's kind of how I see it too. If there's a significant, like somebody wants a really significant change, I'm more comfortable with porcelain being the material of choice. But if they want an improvement, a natural look, but younger, then usually Bioclear can accommodate them. And what's nice about Bioclear is that you can actually place some of it on the tooth and kind of cure it with our light, so the patient gets an idea of how white their teeth were going to be. But if that patient says, well, God, can you go whiter? And I'm already using the whitest composite I have, then we're probably going to make them happy with porcelain rather than with Bioclear.
Right. Another good thought that you bring up is also patients want to know if they're not going to reduce their teeth in size to start with, if they're not going to cut away tooth, how big are their teeth going to look when they're done? And that holds true for both porcelain and Bioclear. And generally the way David and I handle those kind of things is we're able to do a mock-up and show you the size that your teeth are going to become, and pretty much give you an idea before we start how large the teeth will be. And if that looks too large to you as a patient, then you might have to decide, well, maybe I need to trim a little tooth away before I start.
Exactly.
How are you able
Any other questions, ladies? I'm sorry, Megan.
How are you able to show what that would look like?
Okay, so we do what's called mock-ups, basically a mock-up procedure, and we do that for both porcelain and for Bioclear if we have a patient that's kind of wanting to see the increase in size or wanting to see what they will look like. So basically we can kind of create like a little preliminary mold and put some material inside that mold and just let that set, but not bond it to the teeth.
Okay.
And that way we can take pictures. We can actually generate before and after pictures before the patients start. Now, some patients might come to us and just say, I've already seen enough of what you do and I've driven 5 hours to get here. I'm just ready to go forward. I'm ready to do this. And so for those people, but generally I usually like to do mock-ups even for patients who are anxious to get started. I think it's a good learning experience for a patient to get an idea of where we're heading, because I don't want to really surprise the patient at the end.
Right. I think that's really cool that patients can have that option, and that's something that you guys offer. I know if I were in that position, I'd want to see what the before and after would look like potentially.
For sure. Yeah, and keep in mind too that we can affect not only how the teeth look, we can affect the lip support and the shape of the face, which we're not going into here for the sake of this podcast, but we have patients that we can often, depending on how much volume we want to add, we can enhance lip support, and that may reduce their need for trying to enhance their lips with other methods. So, and then sometimes the change to the shape of the face can be more dramatic than actually what happened to the teeth. So we have this sort of balancing act between how much lip support, or are the teeth looking too big, or can the patient handle that volume of lip support?
Exactly. So your cases are amazing. Dr. Carroll, and I invite our listening audience to get on your YouTube channel in the next week or so, because we're going to actually post this on Dr. Carroll's YouTube channel, and you'll get to see the before and afters on his cases. But if you're just listening, there's some dramatic changes to these patients' smiles, again, without taking any tooth structure away. So I commend you and compliment you on that.
Thank you, David.
So with that, let's shift gears here a little bit, and let's ask Dr. Carroll, what he might suggest to a listening or viewing audience as to what they should look for when they're looking to get some cosmetic dentistry done in a dentist or a dental office. So what tips would you give our audience in searching for a dentist that can do these kind of things, Dr. Carroll?
Yeah, that's a great question, David. I think for one thing, I noticed that, the dentists who do a lot of this kind of work are pretty active on social media the way you and I are. So I would want to see some social media presence, because if you love doing cosmetic dentistry, then you're probably going to love to show it. And so you're going to show it on Instagram, and you're going to probably show it on Facebook. So there probably should be some modality that the patient can just call the office that they're thinking of going to, and they'd say, hey, I'd like to see some of the doctor's work. Can I see some of it on Instagram or something like that? Or is there some available on YouTube or something like that? And that would be one way. I think that the patients could start to view before and afters and see if the style of the work agrees with what they're looking for, and, the doctor should have, at least some cases to show. And I would probably, as a patient, I would like to see cases in porcelain, and I would also like to see cases in composite resin. So I know I might have a choice to make. Another way is to look at the doctor's credentials. So David is, I think, accredited with American Academy of Cosmetic Dentistry. That's a very prestigious organization. I belong to a branch of that, the Florida Academy of Cosmetic Dentistry. Another method would be the Bioclear training, which opens up more options for the dentist. So the dentist who has Bioclear training, so the patient can look up Bioclear and contact Bioclear headquarters, and they have basically a list of dentists. They can refer to a map that shows the Bioclear dentists where they're located, and even shows their level of Bioclear training, because there are different progressions of Bioclear training. So that's a couple of things that just pop into my head that I would want to, if I went to the office, I would definitely want to see a lot of before and after photos of patients that had come before me. Cases that look somewhat similar to what mine looks like. So if I'm a patient and I've got big spaces between my teeth, or black triangles in my teeth, or discolored teeth, I want to see cases that have been done that look similar to what my problem is.
Right. No, that's very good. And that's kind of what I try to tell the public. I realize that you're in Miami, and anybody near Miami should be looking for Dr. Carroll for any kind of cosmetic treatment. And I'm in San Diego, and I would tell people that too. But if you're in other parts of the country, seeing the dentist work is probably one of the biggest things, is seeing how they handled a smile and transformed it. And then having that flexibility of sometimes dentists, and I don't mean to critique my colleagues, but the only thing I see is porcelain veneers. So when you go to their office, you're more than likely going to get porcelain veneers. But seeing a dentist that can do composite, like Dr. Carroll says, and porcelain, that kind of dentist, in my mind, is thinking about tooth structure and not taking it away if he or she doesn't have to. And so look for those kind of things when you're looking at for a cosmetic dentist. And then the last thing I would have them look at is look at the reviews on the office, because the patients will tell you a lot about the office and how happy they were and that kind of thing. So those are great little tips to choose the right dentist for your cosmetic dentistry.
Yeah, I agree.
Anything you want to add, girls?
Yeah, I mean, I think it's great that you guys mentioned all these different options because for the patient and even myself as a pre-dental student, I didn't realize that Bioclear or composite was an option to transform your smile. So I think what I would recommend and like kind of shadowing what Dr. Eshom and Dr. Carroll has said is just know your options, because the more options you have, the better chance that you'll get a smile that you're happy with, and you'll have like a route that you can go towards to get your dream smile. And that's the most important part at the end of the day. So it's great that Dr. Eshom and Dr. Carroll are sharing their experiences with composite and Bioclear and minimally invasive cosmetic dentistry so the audience and patients can know.
Anything to add, Megan?
No, I completely agree with what Sabrina said. I think it's great. Also, like Instagram presence, patients being able to look online and see examples of the dentist's work. I think that's really awesome.
Wonderful.
Yeah, I know that's how David and I actually know each other, because we've always followed each other's work on Instagram. So I'm always looking to see what he's doing. I'm looking if I watched his techniques and I'm wanting to learn something from him that I can implement into my practice. Because when you're a minimally invasive cosmetic dentist, we are always looking at each other's work. We're always looking for the next thing that we want to know, or is there something slightly different that David is doing that I'm not doing? And so we love to learn from each other. And so we're going to be, I think most, dentists who are very active with this stuff are going to be easy to find. And David, I actually find dental technicians now the same way. The dental technicians who are really talented that are going to do our porcelain work, they're also on social media and on Instagram too, because they like showing their talent. And so it's become easier, actually, I find, to find talented help for us, even in that porcelain world as well.
Yeah, no, you're absolutely right. And obviously we have the young people to thank for that, because they got the whole Instagram thing going. And then we just kind of surfed it a little bit late, and maybe not quite the same themes that they have. They seem to post a lot of food, and David, you and I, we post a lot of teeth. So
right.
To each their own.
Right, exactly.
All right. Anything else you'd like to add, Dr. Carroll, to the podcast before we check out?
Well, thank you very much for inviting me on this. It's been an honor to be on your podcast. I've admired your work for years now, and just to be asked to even present something on your channel is an honor, and I really appreciate the opportunity.
No, it was love having you, and my compliments go right back at you, and seeing you work on Instagram, and then knowing that you actually teach the Bioclear method for the Bioclear Learning Center. You keep me up to date on the latest that Bioclear has, and so I appreciate that from you. And so if there's anybody in the Florida area that would like a great cosmetic dentist that thinks your teeth are precious and doesn't want to do anything to them unless he has or you have no other choice, then I would make sure they look up Dr. David Carroll in the Miami area.
Thank you very much.
You're welcome. And Megan and Sabrina, anything before we go?
I think we're all set.
Yeah.
Thank you guys so much for listening to Getting Your Dream Smile, and thank you for Dr. Carroll and Dr. Eshom for spreading their knowledge on minimally invasive cosmetic dentistry. Please make sure to leave us a rating and a review on Apple Podcasts, and check us out on YouTube if you want to see the pictures and the recording of the podcast. Other than that, we can't wait to see you guys for the next episode, and stay tuned. Thank you. Bye.
All right.
Bye-bye.
Good night, everybody.
Good night.
Thank you for tuning in to Getting Your Dream Smile with Cosmetic Dentistry with Dr. David Eshom. Be sure to subscribe to our podcast to be notified about future episodes. Click the link in the description to fill out a form if you have any questions on cosmetic dentistry or your smile that you want us to answer. See you next episode.